So today we're going to be doing a video on sectioning. Before obviously you section any patient, you're going to want to go in and look at their chart and make sure that the order is right, make sure you have the right person, and also make sure any issues that they have were resolved. If they were, then it's time to get your supplies ready. So scissors, you might need scissors if your patient's taped and they don't have a Hollister on. My patient has a Hollister, so I do not need scissors. A Yankar, in case there's not already one in the room. A syringe to deflate your cuff. And then also a supplemental oxygen device. Also, like I said, in case you don't already have that in your patient's room. So after you have all of your supplies together, then you can make your way into your patient's room. You're going to sanitize your hands, put on some gloves. As I'm walking into the room, I'm always going to introduce myself, and while I'm introducing myself, I'm also going to assess my patient, look at their LOC, make sure they can respond to commands. So if I'm talking to my patient, I'm making sure that they're looking at me, that they can maybe shake their head, can they grab my hand, can they move their arms, just making sure that they're wide awake and they're ready to go. So I'm going to introduce myself, hi Mr. Williams, how you doing today? My name's Jordan from Respiratory. We're going to go ahead and get this breathing tube out of you, okay? You've been doing a really great job. I'm also going to listen to his lungs, make sure, there's not a whole bunch of secretions in there. And then, just one more time before we extubate, I'm going to go and suction him just to make sure there's no more secretions down there. We're going to just one more time, Mr. Williams. Good. Big cough for me. Good, good. So then we're also going to remove the inline section and put the Yankar in place. And then I'm also going to suction out his mouth just to make sure there's no extra secretions in there and around his cuff. So before I do anything else, I'm going to go ahead and put him in semi-Fowler's or high Fowler's position. And then normally people would have an assistant to do this. I don't, so I would go ahead and start removing his Hollister while also maintaining the tube, making sure I'm not letting go, nothing's going to happen to it. Also, while doing that, I'm going to deflate his cuff. Tell him to take in a big deep breath as I deflate. Good job, Mr. Williams. And then as he's exhaling, big cough, I'm going to go ahead and pull it out while also watching his vitals, making sure everything's okay. I'm going to listen to him once again, make sure he's fine, assess him, make sure his LOC, everything's just fine. And then if indicated, I'm going to go ahead and put on a supplemental oxygen device. So this one right here, I have a nasal cannula. Go ahead and put that on him. And like I said, if your nurse isn't in there with you after the procedure, you'll just go ahead and let her know that you did extubate, what time you did it, and if there was any complications or anything going on. And then after you let her know, then you're going to go ahead and go out of the room and chart. And after that, you should be good to go.